The artery that is spared in polyarteritis nodosa. A. Bronchial artery. B. Renal artery. C. Coronary artery. D. Pulmonary artery. Correct answer D. Pulmonary artery. Polyarteritis nodosa is a multi-system necrotizing vasculitis of small and medium-sized muscular arteries. It is characterized by the involvement of renal and visceral arteries. Pulmonary arteries are not involved in PAN, although rarely bronchial vessels may be involved. Lowy bond angle is A. Angle between the iris and the cornea. B. Angle between the long axis of the forearm and the long axis of the upper arm. C. Angle between nail bed and proximal nail fold. D. Angle between manubrium sternum and body of sternum. Correct answer C. Angle between nail bed and proximal nail fold. Explanation. Lowy bond angle or hyponychial angle is normally around 160 degrees. It is more than 180 degrees in digital clubbing. Lowy bond described it as a profile sign. It is interesting to note that clubbing was first described by Hippocrates in 400 BC in a patient with empyema. Postural orthostatic tachycardia syndrome is characterized by all except A. Women affected more commonly than men. B. Heart rate more than 120 per minute. C. Increase in heart rate more than 30 per minute when standing. D. Usually presents with orthostatic hypotension. Correct answer D. Usually presents with orthostatic hypotension. Explanation. Postural orthostatic tachycardia syndrome (POTS) is characterized by symptomatic orthostatic intolerance without orthostatic hypotension that is associated with either heart rate of more than 120 per minute or increase of more than 30 per minute when standing that subside on sitting or lying down. The symptoms of orthostatic intolerance include lightheadedness, blurred vision, palpitation, and nausea. Usually affects women more than men. This syndrome develops between 15 and 50 years of age. Which of the following is not a feature of right heart failure? A. Jugular venous distension. B. Hepatomegaly. C. Basal crepitations. D. Ascites. Correct answer C. Basal crepitations. Explanation. Basal crepitations are seen in left heart failure. Other findings in right heart failure are right ventricular third heart sound, heard at left sternal edge, better in inspiration, wide splitting of second heart sound due to prolonged right ventricular ejection and delay in pulmonary component or P2, and peripheral edema. Riociguat is used in the treatment of A. Gouty arthritis, B. Rheumatoid arthritis, C. Chronic thromboembolic pulmonary hypertension, D. Obesity. Correct answer C. Chronic thromboembolic pulmonary hypertension. Riociguat is a soluble guanylate cyclase stimulator. It is the only therapy approved by US FDA for inoperable CTEPH, chronic thromboembolic pulmonary hypertension. Best treatment for operable cases is pulmonary thromboendarterectomy done in expert centers. Rivaroxaban is an anticoagulant belonging to the category of A. Factor 10A inhibitor, B. Direct thrombin inhibitor, C. Vitamin K antagonist, D. Low molecular weight heparin. Correct answer A. Factor 10A inhibitor. Explanation. It is used in the prevention of deep vein thrombosis after hip and knee replacement surgery. Rivaroxaban is also used for treatment of deep vein thrombosis in higher doses. Stroke prevention in non-valvular atrial fibrillation is another role. It is better avoided in those with significant renal dysfunction. Most specific symptom of temporal arteritis: A. Visual loss, B. Jaw claudication, C. Temporal headache, D. Polymyalgia rheumatica. Correct answer B. Jaw claudication. Giant cell arteritis, temporal arteritis, is a chronic vasculitis of large and medium vessel arteries, usually affecting the cranial branches of arteries arising from the aortic arch. Jaw claudication is an underreported yet a very specific symptom of giant cell arteritis with a high positive predictive value. Which of the following is not a component of syndrome Z? A. Obstructive sleep apnea, B. Hypertension, C. Hypertriglyceridemia, D. Elevated HDL. Correct answer D. Elevated HDL. Explanation: Syndrome Z is a combination of obstructive sleep apnea and metabolic syndrome. Metabolic syndrome is characterized by hyperglycemia, hypertension, hypertriglyceridemia, and low HDL, along with abdominal obesity.